Okay. Good morning, ladies and gentlemen. I would like to talk about, I think, some challenges that we are faced with personalized healthcare, and there are some keywords that we are always referring to, but we're trying to find solutions like integration, intelligence, adaptation. So these are notions that we're trying to resolve through our research and development and through the applications that we're trying to more or less come up with. I will try to address these three axes, more or less, via some, let's say, examples. Like, for, let's say, example, if, let's say, we want to see what is happening with really an integrated platform, one example may be one of the IPs that we ran for 4.5 years, more or less, that finished last month, the Sensation project, where, let's say, we had, on the one hand, to develop some sensors, nano if possible, but it was both nano and micro. Then we would go into application areas, medical applications and industrial applications, and the idea in the end was to come up with an integrated platform in order to provide these services. Then I will talk about some new ideas that we are trying to develop that are related to adaptable and intelligent and personalized health systems. So how we can move into some sort of an interoperable and open biosensor network framework. And that would be linked with the way that somebody, in essence, a physician or a professional can embed intelligence, can, let's say, insert intelligence into these systems. I think this is one of the largest, I would say, interesting areas that we will be faced in the years to come. So the current status in pHealth is that we have a variety of pHealth systems. Already we have seen a number of them. And typically we have adopting sensor networks for multi-parametric physiological and ambient monitoring. And we have a number of let's say, focus areas like unobtrusive monitoring, the user interfacing, the cost effectiveness, which is always a global issue, the reliability of the measurements, the quality of data, and finally the multi-parameter analysis that, let's say, should be done according, of course, to the application scenario we have. There are some open issues for the pHealth vision, like, for example, in general, generic solutions, interoperability, which is a very difficult area to cope with, adaptation of the systems, the embedment of intelligence, as I said before, which would lead to better medical decision support, the quality in healthcare services, in personalized health services, which is measured, again, at a number of levels again. Quality is perhaps at the level of data. Quality has, let's say, to be there at the level of services, at the level of, let's say, efficiency, at the level of, let's say, cost efficiency, everywhere. So it is a very complex environment. And the standardization issues, and finally, following to what Luciano said, the incorporation of these systems within the healthcare delivery chain, in essence, to use them as interventions to produce evidence-based medicine, in fact, at some point, to show that indeed these systems can really help provide a better, let's say, healthcare. So if, let's say, we take for, let's say, example, the Sensation project, which I think is a good example because it really incorporates a number of these elements, we can see that what was the aim then, 4 or 5 years ago, we can see some keywords like unobtrusive, cost-effective, real-time monitoring, detection and prediction of, let's say, human physiological states. And of course, that particular project was linked with the application of, generally speaking, the sleep disorders. Okay? So for, let's say, example, these are two of the very interesting sensors. I mean, just an example of the pool of, let's say, sensors that were developed. The Enobio sensor, that is a microsensor, that is, let's say, a nanosensor, that is based on, let's say, carbon nanotubes, okay? And this is quite a very, I would say that was one of the let's say, success stories in this project. And you can see now the prototype that Starlab is, let's say, having, like a hat that is, let's say, having the sensor on it. And of course, it embeds also the, let's say, communication module. And the other, which is quite interesting also, which was developed by CSEM, was the, let's say, ring sensor, the finger ring sensor. Okay, and these are examples of, let's say, sensors that are developed within this project. Of course, there are many more sensors, but just to show you that indeed technology can really move forward and provide really even nano solutions today. Okay, although it is not as easy as, let's say, it may sound. In the applications domain, in the medical applications domain, we had some diverse type of applications which would correspond to using different types of, let's say, sensors, like insomnia treatment or obstructive sleep apnea syndrome diagnosis, or drug, let's say, induced, let's say, hypovigilance. All these medical applications require a mapping of, let's say, what, let's say, we want to find to what sensors we want to use. And this is more or less the integrated platform that we had. So we had the sensor body area network, the home workstation, we had the backend signal analysis and the clinician work station. And let's say, communication modules are here. And that is the backend of the clinician application. So in fact, we go from, let's say, sensors, from, let's say, recording, to communication, to analysis. Now, if, let's say, we want to go to more intelligent, personalized health systems, today we have, for sensor networks, a number of, let's say, challenges that are spanning from, let's say, interoperability to intelligence to energy. And in fact, there is a proposed approach, the intelligent biosensor network, let's say, configuration, where, let's say, we are based on formal sensor descriptions.